Hello and welcome back. In this lecture, we're going to be talking a little bit about how you take this information that you've gotten from about public health and present it to the public. How do you present it in a way that people understand it? And how do you take into consideration how they perceive different types of health risk information? Since we'll be on the topic of individual perceptions around health and health communication, we'll also talk a little bit about how one could go through the process of making decisions about how to go forward with a health-related procedure. All right. So before I start talking about this, there's a significant step between doing research to find information about morbidity and mortality in the population, different types of health information that you can get from various different surveys, different monitoring type data that you get from public health. There's a difference between taking some of that information and actually presenting it to the public as something that you believe is high quality. Unfortunately, there's actually a wide range of different types of quality in data that's out there. Some of it's based upon differences in terms of how the data was actually produced itself. How is the study designed? What is it telling you? What is it not telling you? There can be perfectly good studies that gets misinterpreted by the person who's presenting it, and they really don't show what people say they're showing, right? So it's really important when you're trying to provide information to the public that you are very responsible about the sources that you're getting information from. So there are a range of different sources out there. I've talked about them already a little bit, but really when you think about this, you want to be taking into account, is it, for example, a governmental based source? Is it a source that's more likely to be a little bit more neutral? Is it a source that is a nonprofit where their funding may rely on them showing that this is a really serious disease, for example, right? Remember, all data and how it's presented, there's going to be political influences on it, both in terms of what data we choose to produce, what types of research we do, right? We do research because we think it's important, because we care about it. But we also sometimes do it because that's where the funding is, right? So that can influence what is actually produced and is put out there. There can also be political influences on what data is presented. Again, like if you have an organization where you got to show that what you're doing is important, well, you're probably going to choose the data that seems to most emphasize the things that suggest that you're doing a good job, right? And yeah, so that's both how you present it, so how you contextualize the information that you have, and also which data you particularly choose to present to the public. Okay, so you just want to keep this in mind. Having these political influences, having these biases, shouldn't lead you to think that everything is inaccurate or think that you can't trust anything. But you need to be recognizing that there is that potential for bias, and to take that seriously as you're going forward. And just remember that science and research is a social enterprise. It's not some sort of objective fact in the world, right? We have a lot of things, social factors that influence how we produce information. And therefore you should always have a skeptical eye to think about it carefully, because if you start providing inaccurate information to the public, they're going to stop trusting you. And that's actually a really big problem for public health. All right. So let's talk a little bit about how you take health information and you actually create a campaign to talk to the public about some issue that you're interested in. So there's a few different ways to think about this. One of them that I think is kind of helpful is actually comes out of fields of business. How do we actually, and marketing, how do we actually market products, sell products to the public? Now, experts in marketing have created this framework for thinking about providing information like this. And it's called the 4 Ps. So the first thing that you need to think about and clarify is what exactly is your product? So in this case, when we're thinking about public health, we're thinking about what is the behavior or the innovation that you're trying to promote here. Is the innovation that you want people to exercise more? Is it that you want them to start doing exercise monitoring to track their steps, for example? Or do you just want them to eat differently, right? These are your products that you're trying to sell as a public health professional. Okay. Now, price, when you're thinking in a consumer sense, that's just a cost of a product that you're selling. But from a public health perspective, we're really thinking more broadly about the barriers and benefits to taking on a public health intervention. For example, if exercise is the thing you're going to promote, well, a barrier might be, well, I don't have sneakers, or I don't really like exercising very much. And the benefits might be, well, I believe that this will help my health and I'll live longer because of this, and it might look better, right? So, and the cost might be, well, I have to buy sneakers or something like that, right? So you think about each of your ideas and you try to parse it out in terms of what those factors are for your consumer. In this case, who is the public who you're trying to convince. The next thing that you want to think about is a place. So who are you targeting with your campaign, all right? There's a really important idea in public health communications, which is that if you're targeting everybody, you're targeting nobody, which essentially is saying interventions that just say are talking to the whole population tend not to be very effective because they don't really pay attention to the needs of the people they're trying to talk to, right? So if you have a campaign that's culturally tailored, that particularly talks to, say, young adults, or talks to older populations, elderly folks about health-related needs, or that looks at the LGBT community and thinking about their needs specifically. When you create a campaign that is very specific to the needs of that community, people pay more attention to it. It's much more effective as a campaign than something that just generally says, do this healthy thing. Okay. So figuring out who your target audience is very, very important, because once you know who your target audience is, then you think about, how do I actually reach that target audience, right? So you wouldn't want to try and reach teenagers through the New York Times, probably. I mean, as a general rule, that might not be the best way to communicate with folks. It might be through Twitter or Facebook or some other form like that, perhaps, or through some other type of media, right? So you need to figure out who you're trying to talk to, and then how are you going to get to them, okay? And then you need to go through a process of actually figuring out what your promotion strategy is. So how are you going to develop that campaign to specifically talk to that population that you're trying to reach? Okay, so that's the 4 Ps. That's how it works, and it actually is pretty effective for thinking about how to create these campaigns. Now, there's another framework that's, I think, also helpful for thinking about how these communications sound and how you can design a communication so that people hear it, they pay attention, and they use that in their decision making, that they don't just discard it automatically. So the first component to this is simplicity. Now, that's pretty straightforward. The idea here being, when you have these really long, complex messages, people start tuning you out. It's just too complicated. You lose people's attention span. So you want to figure out a way to make your message as tight and as simple as possible. Now, that's often really hard. When I have worked on various projects where I want to talk about complex genetic information, for example, I want to put in all this different information about the ifs, thens, and buts, right? But you have to really work hard to pare it down to what is really the key information that you want people to hear. Another element that affects the effectiveness of campaigns is, how unexpected is it? When you see a commercial, for example, where as soon as you see it come on, you already know that it's selling you something. You already know what it's telling you. You start tuning it out, right? Having something which seems surprising, that doesn't seem in like an ordinary sort of approach to things, that's the thing which keeps people's attention, right? So you want to think about, how can I come at this from a different angle so that people actually notice what I'm saying. Another thing is being concrete. When you say a lot of things about a health-related issue, but you never sort of clarify what you actually want them to do, what the strategy is, what the important things, whether you want them to exercise for 30 minutes a day, 30 minutes a day, 30 minutes a day. You make a very concrete goal, some sort of thing that you really want them to do, right? When you say you should just exercise more, well, that's actually a pretty vague sort of statement, right? Having that concrete idea helps people to set those goals and those wrap their brain about what you're trying to say. Credibility is also important. So credibility is not just about the message and how you say it, but that is important too. It's also who says that message, right? So you think about a population and you think about who are they going to want to hear talk about a health-related issue. So in some cases, it might be a healthcare professional, right? So sometimes you have a physician in a jacket and they talk about a health-related thing. But in other cases, maybe for exercise, maybe what you'd rather hear about is from a mother who's struggling with, keeping up with her exercise routine. And, it can relate to the fact that it's actually hard to do this. Maybe they're the person who's actually going to be better at communicating this, right? So who comes across as a credible person? Sometimes it will be an expert. Sometimes it'll be a person just like you, or just like the target audience, as the case may be. But thinking carefully about who that person is going to be really important for how people receive the message that you're trying to convey. Another thing is that emotions, how people emotionally engage with something, is tremendously important. So messages that somehow connect in either by telling a story or by connecting with things that people are afraid of, or things that people really love or appreciate, or value. These are things that can start to make people feel something so that they actually pay attention to what you're saying, right? Unfortunately, when you're public health can sometimes feel a little dry. And when it's dry, well, people will turn you out. And it's understandable. Everybody's like that. We get that. But we'll talk about that a little bit more later. And then finally, stories. Stories tend to be really effective for engaging people. Being able to describe somebody's actual experience with something really helps people to put themselves in their shoes and to imagine themselves in a certain role, right? So this can really be a very effective way of engaging people in connecting them to and helping them envision the reality of a situation so that they can envision themselves exercising or doing whatever it is that you're trying to promote for them. Now, coming back to the idea of emotions, emotions do play an important role in how people respond to different types of messages. Now, what we find when we look at people's responses to public health messages is that there are people cognitively think about these things differently. So there are certain things where we don't sort of see them as being threats, where they just seem as normal, right? And when you can't sort of see a dramatic or, significant impact, it's very hard to raise that perceived threat, an actual fear of something happening. So if you look at the backyard pool, well, the backyard pool looks like a relaxing, fun, calm place to be, right? But we actually know that a lot of people die in backyard pools. It's actually quite dangerous. However, if you look at the picture below, you see that shark going after the guy swimming. Well, probably a lot of you, if you look at that picture carefully, your heart beats a little faster, right? There's like this very immediate physical response of fear there. So what you find is that things that can elicit that fear, that concern, actually tend to attract more attention to things when you can actually visualize those consequences of a health impact. Another thing is the unfamiliarity effect. So this actually goes in two directions. It can actually increase people's concern about familiarity, it can increase people's concern about health, or it can also decrease people's concern about health. And this kind of depends on whether people are familiar with the health consequences of a disease versus familiar with the behavior that causes a disease. Okay. So for example, if you have a family member who has died of colorectal cancer, for example, you've been with them as they've gone through the process of experiencing that disease, right? And that's really hard. And that causes, for people who are very familiar with that experience, it causes real concern about it and a lot of attention for them when you're trying to promote a public health issue. Now, on the flip side to that, if you're very familiar with the behavior but less familiar with the consequences, then that makes a public health message much less prominent. So, for example, when you see something like going out to an amusement park and not wearing sunscreen, well, being out in the sun is something that we're very used to. It's just something that feels very normal. But we know that skin cancer is the most common cancer out there, right? So this is a real thing that can happen, but we just don't see it as being serious because very often we just don't register the idea that there's actually a threat that could come out of this. Okay. So another sort of psychological effect that we see is called the uncontrollability effect. All right. So what we find is that when people feel like they're in control of the behavior that could lead to the health risk, that they tend to be less concerned than when they have no control. So the classic example of this is people tend not to be very scared about the fact that they are jumping in their car and driving off to some place, right? Although really getting in your car is one of the most dangerous things you're going to be doing, right? It's actually pretty dangerous. You're moving along 70 miles an hour, perhaps, if you're breaking the law, which many of us do. And, you hit something hard at that speed. You're very lucky if you get out of that without harm, right? Whereas you have something like air traffic, airplanes, and people are actually really scared. Getting on an airplane. People, whenever I go home to New York, my mom always says, be careful, be safe. The truth is that air travel is incredibly safe. It's much safer than traveling by car for the same distance, for example. But the idea here is the idea of going down on a plane and not having any control over that happening tends to be very scary to people. So that is sort of an effect that you can consider in terms of how people respond to public health messages. All right. So thinking about these messages and how we try and communicate with the public, I think it's helpful to see some examples of this. And this is an example that came out of smoking prevention attempts that were really targeting adolescent populations. So there's two different campaigns which I'm going to show you. The first is called the Think, Don't Smoke campaign. And then the second is called the Truth campaign. And I want you to pay attention to both of these public service announcements and see what you think about them in terms of how well they match the criteria of the 4 Ps and the success framework for addressing a public health issue.
Easy. Hey, you.
Me?
Yeah. Did you ever try cigarettes?
I was 14.
Any reason?
I guess I was trying to be cool or something.
Really?
Well, yeah.
So you tried it because other people were doing it?
Yeah, I guess.
And why don't you do it anymore?
A lot of reasons. Just didn't like it, I don't need to smoke to, fit in. Hold up. We finished?
We're going to leave this here for you so you can see what 1,200 people actually look like.
All right. So one of these advertisements actually worked and the other one did not. So as you can see, they're quite different. So think a little bit. I'm not going to tell you right now which one was the better advertisement, but think a little bit about what the different components were that they tried to use, what strategies that they tried to use to convince people to not smoke. And try and think about which you think would be more effective. So an interesting puzzle for you. Now, when we think about advertising and communication about health, I mean, smoking is a great example of this. We do often think about these public service announcements. This, when we think from a governmental level, this very often is funded through the Department of Health and Human Services and their funding. Now, when you think about public health and the way that we try and impact public health, we, in 2011, which is the most recent data I was able to find, DHHS spent $87 million on public communications, public service announcements targeting the public. So think about that. Does that seem like a large amount of money or a small amount of money? Well, let's take a look at some of the alternatives. Okay. So when you look at the budgets for companies that are trying to promote these products, those budgets are much higher than what public health agencies are able to put forward, right? So for example, cigarettes and tobacco, they put out about, $8.5 billion in advertisements in 2010. For junk food and soda, that's around $2 billion. For alcoholic beverages, that's about $3 billion, right? So here we're seeing that some of the industries that are promoting behaviors that are typically not very healthy actually are putting a tremendous amount of money into advertisements. And if you think more broadly in terms of advertisements in general, there's a huge amount of money put into this in the nation as a whole. So in the United States, we spend about $180 billion per year on advertisements. Now, this is really important because when you think about public health and public health strategies, it's very hard for us as public health professionals to really make a difference, right? Because we're in sort of a drop in the bucket in the sea of information that's being put out there. How do you convince young children to try and eat healthfully when every 10 minutes a commercial comes on for breakfast cereals that are full of sugar, right? So it's a really hard thing. What I will say is that if you follow the strategies I've talked about, if we as public health professionals really think carefully and strategically about this, we actually can make a difference because we can be more credible. And people recognize that advertisements are trying to sell them something and that alternative views are valuable. So you shouldn't be discouraged, but you should also be knowledgeable that we're talking about a fairly challenging media environment that we have to be really savvy to make a difference in. All right, so let's talk a little bit about how we present risk information. So this is an important question, right? So very often in public health, we think, well, here's an issue. Let's just tell people about how bad it is, and they'll stop doing it, right? It seems like a logical thing. It seems perfectly rational that people would stop doing this risky behavior or would adopt a new strategy or something like that. Makes sense. And this really follows from sort of the old view of how people think and how people think about risks. And that's the view that the mind is a computer, okay? So long as people understand, the idea here is that so long as people understand the question and they are able to apply their mind to it, that they will use numbers and they'll sort of measure it out and they'll use it to make a decision about whether or not to do something. So that one of the things here is that the hope is that you would actually have a good ability to measure and understand how people are responding to this information. That trying to get that number into their head so that they can actually make those decisions is sort of one of the main goals of public health communication strategies. Now, there's also sort of a newer view of this, which is actually takes a very different view of how people think about health information. This is that people don't really think numerically, that instead they think qualitatively. So they think in terms of a more fuzzy understanding of generally what is going on. They have a story that they build around a health-related decision. So when they go through this, it isn't that, that there are actually numbers in the head, that if we studied them better, we would be able to find out how they're ranking numbers to make a decision. It's that they're actually not really using numbers to make decisions, okay? Now, that isn't to say that you can't get people to look at numbers and think about numbers, but it's just really difficult for people very often. It's just not an intuitive way of doing to take this very rational mathematical approach to making decisions. So, what they do as they're trying to think about this is they try and take these idea of these the numerical risks, and think qualitatively about it to assess it in terms of their values and their concerns and their emotions that influence their overall decision. All right. So their overall decision is really going to be based on a combination of all these general understandings of risk, understandings of what their desires are, benefits, challenges, etc., that they sort of put together, and sort of their general emotional response to this as well, right? So when I say the term gist, there's sort of two ways to think about how people represent health risk information, right? A gist representation is essentially the bottom line meaning of information. If you ask someone, what does this mean? Well, this means I'm really at risk. I'm concerned, right? That's a bottom line meaning. It tends to be pretty vague, and it tends to be qualitative. It tends not to be this sort of numerical, factual information, right? And again, this gist understanding has a lot of different things that come into it, emotion, etc., that help build this to be their overall response to a health risk communication. Now, there's also the idea of a verbatim representation, and this is the exact number. This is the numerical quality of the risk that they're trying to understand, and this is precise and quantitative, okay? The literal meaning of a communication. So just to illustrate this, let's go through an example here. So imagine that you have a surgery that's going to be occurring, and it's called the carotid endarterectomy. So this procedure, you tell a patient about it, and you tell the patient that they have a 2% chance of dying on the table. But if they don't have the surgery, that they have a 22% chance of dying without it. Okay. So that's what you tell them, right? So if you then they come back into the clinic and you ask them what they think about this later on, and they imagine you have two different patients. Patient one recalls that the surgical risk is 10%, okay, of dying if they do get a surgery. And then patient B believes that there's a surgical risk of 0, that there's no chance that they will die on the table during a surgery. So from a gist perspective, which one of these patients is better informed? All right. So you see the facts on top, and then you see those two possible responses. Who is a better informed patient? Well, think about it this way. Patient B is actually closer numerically to the risk. Remember, 0% is closer to 2% than 10% is. However, patient A is actually better informed in a sense, because even though they're off by some percentage about there being a risk of dying on the table during a surgery, they're recognizing that there's a risk. They recognize that bottom line gist information that if they go get the surgery, that they really might die, right? It's much more concerning that patient B thinks that there's no risk, no possibility at all that they'll die, right? So in a sense, even though numerically patient A is further off, they're much closer to the real bottom line understanding of the communication that they received, okay? So again, that's the idea of gist understandings of risk information. So what do we find when we try and communicate using these numbers? Well, unfortunately, what we find very often is that there's a big difference between what we try and tell people these numerical risks are and what they reflect back to us. They often forget it and they often don't understand it. Okay. Now, there's a few reasons for this. And one of those reasons is honestly that the public actually isn't very good with numbers, generally speaking. And that's unfortunate. It's partially due to how we treat mathematical education in our country. But I'm going to give you a few examples of this just so you understand this. So this is a survey that was done, I'll show you in a few seconds, with about 300 women. And they were asked 3 different questions about numerical understanding. Okay. So the first question was, if you roll a die, a fair 6-sided die 1,000 times, how many times do you think it would come up even? So 2, 4, or 6, right? So a basic probability question, okay? So then they ask, which of the following numbers represents the biggest chance of getting disease? Which one of these is most probable that you'll get a condition, okay? So then the last question says, if a chance of getting disease is 20 out of 100, this would be the same as having blank percentage chance of getting disease. Okay. So these are basic questions about probability. Okay. So let's see how people did when they were asked this survey. Well, again, this is a survey of 301 women ages 40 to 75. Okay. Now, when you look at this chart, the yellow bars are for people who've had a high school education and the green bars are for people who've had a college education. Now remember, in the United States, only about 30% of the population in the United States has a college degree, right? So most people have high school educations, right? So when we think about that, they're sort of the majority here that you're going to be talking to as a public health professional. So for that first question, which is about the fair-sided die, right? So you'd expect that half the time it would come up even. Well, what we find is that 70% of people with high school education and about 45 people with a college education actually got that number wrong. All right, so the second question was, is 1 out of 10 versus 1 out of 100 versus 1 out of 1,000 a greater chance of developing a disease, right? And this 1 out of 10, obviously, because that's the highest risk, right? Numerically speaking. Well, we find that a fair number of people, both high school and college levels, didn't understand that information. Although they did seem to get this one better than the other types of numerical risk information. And then when we ask people to translate that information into a percentage, well, we get 60% and 30% of people who don't understand and get that question incorrect, right? So there's a real concern here. This is suggesting to us that when we tell people these numbers, very often they don't even understand what we're saying, right? So that means that we have to have better ways of communicating with the public about health risk information, and that we can't take this sort of mind as computer model for assuming that people take risk information and just absorb it and make the right decision. Okay, so what are some different strategies that you can use? Well, we just talked about numbers. So what we saw there is that numbers, people often don't get it. You often do want to provide numbers, but just don't count on them understanding them, right? What we do find is that often if you can communicate in those numbers in multiple different ways, people will get it at least sometimes one of those ways. So you increase the odds that people understand things if you communicate it in multiple ways. All right. So you could say, for example, the risk for this disease is 30% that you'll get it, which means that if you had 10 people, 3 people out of that 10 would get that disease. Okay. That can be a helpful way for communicating this. And the 3 out of 10 is a very helpful strategy. Okay. Another way to communicate about risk is to say it verbally. So if you're talking to a patient, you could say, this is very unlikely, or this is very likely, or there's a very small chance that you'll develop this disease. Well, the problem with these verbal responses, so people do kind of get a understanding from this, but it tends to be very fluid. So how people understand these words tends to vary substantially. So let me ask you, for example, if I said that you're very likely to develop a disease. How probable do you think that is? If you tried to assign a number to that, how likely do you think it would be? Would it be 10%? Would it be 50%? Would it be 90%? How much does that mean when I say that you're very likely to develop disease? Well, here's the thing, is you probably have an idea and you think that that might be really generally what it is. Well, you actually do studies with the general population. What you find is that people, when you say you're very likely to develop this disease, people interpret that as being anywhere from around 30% up to 90% probability that they'll develop a disease. Well, that's a big difference, right? That means that they have a very broad and wide variation in terms of how people understand that information, right? So what's really important here is to, if you're trying to say something's very likely or probable or things like that, or even if you're using the percentages and numbers, it's really important to ask those patients to reflect back to you what they thought you said, right? How they understand that risk being. And then you can negotiate to try and help them get that. What I'll also say is that one of the best ways to communicate risk information is actually visually, okay? So there's a few different strategies for this. People like pictures, and sometimes it can communicate things that words and numbers don't do very well. So, for example, here's a histogram, which is a bar chart where you look and you see that how high on this chart do things fall. And here we're looking at a bypass surgery. So if each chart on either side indicates a certain number of people, well, different people might have different need for different numbers of people have a need for a bypass surgery, right? So, here you're just reading by height, but it can be hard to be precise sometimes, but it's pretty easy to compare between the two of them. It can be distorted by shortened axes, so it can make it look much bigger or longer depending on how you put the numbers on the axis. But it's an okay way to convey information. Another way to do this is to show a pie chart. So we see that sometimes. The good thing about this is that it's you can tell sort of the part to the whole reasonably well, but it's very hard to be exact when you look at this. So if you look at that larger one, being precise about how much of a percentage that is visually can be hard. And also, especially if they're 3D charts, they become very complicated, right? So sometimes it's hard to really make a very precise estimate from this. Now, what we've generally found is that pictographs tend to be the best way to communicate about risk information with the public. So when you actually measure how people understand risk information, this is the best approach both for measuring for people's just understanding of the bottom line meaning of a health communication, and then also it's best for their verbatim understanding of a health communication. So being able to say this number, this percent, okay? Basically how these work is you just look across the different alternatives. Here we have no pill versus pill versus pill B. And it's essentially saying how likely is it that people develop a disease given those different considerations. And because you have a certain number of people actually shown out in those charts, and you can see how many people in each of those conditions have the disease, you actually get a pretty good idea of what your risk is if under those three different options. Also, the other nice thing about this is there's less interpersonal variation. So people will, if you ask multiple people about this, they tend to say the same thing. There tends to be reliability. All right. So again, how you choose to convey communication is going to communicate risk information is going to vary depending on what your needs are, right? How precise do they need to understand this information? So if you're talking about the surgery example before, well, if someone really might die from having a surgery, you probably want them to have a pretty precise understanding that this is a risk. Whereas for other things like, exactly how many minutes you need to brush your teeth maybe less important that they know it's exactly 2 minutes or something like that. Or, there might be situations where you just want them to generally understand something, and then you're really focusing on a general gist understanding. So you might not narrow down to that specific number, right? Because that tends to take a lot more effort. Okay. The other thing, again, the strategy that I recommend using if you're ever talking to somebody about this, where you're especially trying to help them understand how risky something is, that you ask them to talk to you about how they understand it. So you can say something, you can think that you're being perfectly clear, but what's really important is how they understand it. And you can usually figure that out by having a conversation with them. And then typically, your best strategy is to focus on these gist approaches, making sure that at a fundamental level, they generally understand what the bottom line meaning is of the message that you're conveying. All right. So we've talked a little bit about how you communicate about risk. And part of communicating about risk is to help people to actually make good decisions. All right. So there's a range of different ways that we can help people take risk and health information and make a decision about it. Now, in healthcare, there's these different strategies have different names, and they sort of one of them that's been used sort of historically, especially, was called informed decision. And this is the authoritarian approach, where the clinician essentially decides you as a patient are going to do this thing, okay? Where there isn't really a discussion about it. It's just a decision, okay? So that's called the inform of decision approach. Now, there are advantages and disadvantages to this. So what we find is some people actually really like their clinicians to make decisions for them. Typically, this is very common for elderly populations. So a lot of older folks, they really struggle and get frustrated with complex decisions and lots of numbers and things like that. And very often they very much prefer that a clinician who they trust just makes a decision for them. So that's a very common message that we see in public health and health professions. Okay. There's disadvantages though. It can be alienating for some people, especially people who want to make decisions, have a role in this. And they might not understand the whys of this. Sometimes having better understanding of it will help them to actually enact this decision that the clinician is suggesting. Another strategy is called informed consent. So here's where a clinician makes a recommendation. They say, this is the thing I think you should do, but they try and educate the patient so that they understand exactly what the decision, this idea is that they're being proposed with. And then the person has the ability to make a decision about whether or not to go forward with this. Okay. So that's the informed consent approach. And this is very often used in legalistic sort of context. Very often in research studies, you have to have informed consent. But it does respect the autonomy of a patient in the sense that they can make a decision one way or another. And then there's also that focus on making sure that they understand the health-related issue. Another strategy, which is becoming much more common and is often appreciated, is this idea of shared decision-making. So shared decision-making is where the clinician says what they think should happen, and then the patient says what they want. And they are provided with information, and they work together, and then they come to a shared decision about what the right thing to do is in this situation. And that can be as a conversation. So that has the advantage of having the clinician provide suggestions, and then the patient also having a say in this and being able to think through this in terms of what will work for them. And that can often be really quite engaged. But there's certain circumstances in which patients may not be the best judge of the certain health situation, or if the clinician, for example, refers them out to learn about this question, well, they may or may not entirely get that. So get all the information they need. So there is some risk to doing things in this strategy. And then you have non-directive decision-making. So non-directive decision-making, which isn't covered in the Riegelman textbook, is the idea that sometimes it might be better for clinicians not to actually tell the patient what they think at all. So these are situations, for example, if you have a genetic test and it turns out that your child might have a genetic disability, it's generally believed that clinicians should allow patients to make that decision for themselves, that they shouldn't impose their own moral and ethical views on the patient, and that it's really up to them. So this has some advantages in terms of allowing people to come to their own decisions based upon their own values. But sometimes actually it has disadvantages. Sometimes patients feel abandoned in terms of making these really hard decisions. And sometimes it can actually be helpful for them to hear how clinicians think about that challenging question. So here, the main thing that I want you to understand is that there are different ways of approaching decision-making with patients, and that there's real questions about how to be a compassionate healthcare provider. Sometimes a compassionate thing it might be to respect your patient's desires and actually just to tell them what the answer is, to tell them what they're going to do, and not to confuse them with lots of trying to decide it. Sometimes it's overwhelming to have a disease, and it's actually unkind to make them try and make the decision themselves when they don't feel capable of making that decision. This happens a lot in oncological care for cancer, where it's a very hard thing, it's very complicated, and sometimes it's just a much better experience to actually allow other people to make those decisions for you. So, but there's also a lot of situations where people really want to have a role in that decision. And that's also important to respect and to have ways of bringing in patient voices and helping them to have autonomy in their decision making. All right. So that's a whole bunch of ideas around public health communications. How do we design things so that people understand and notice them, and that might actually make a difference in their behavior? How do we think about how people perceive information, especially complex information? How do we convey risk to people so that they can use that in their decision making? And more importantly, how do we help them to understand the bottom line meaning of what you're trying to convey to them? And then also, if you're trying to help them through a process, what are different strategies for how we help them to make decisions that are the best for them? All right, so thank you very much for listening, and take care.